Welcome everyone to the Kids Health Finalist Spotlight session of the 7th Annual Digital Health Awards. I am thrilled to be joined by Mark Goldstein, our executive producer, CEO at Great Gums and partner at Builders VC, as well as Jacqueline Baker, founder and principal consultant at Scarlett. Today, you'll hear directly from the standout finalists in this important category, companies shaping the future of healthcare across the globe. I'm Bethany Bosher, the show director of the Digital Health Awards this year, and excited to welcome all of you. This is my 4th year with the Digital Health Hub Foundation, and it's been amazing to watch how quickly the digital health space continues to evolve, especially in areas like kids' health. At the Digital Health Hub, we're here to celebrate the innovators shaping the future of healthcare. So thank you for joining us. I just want to take a quick moment to introduce the Digital Health Hub Foundation, the 501c3 nonprofit behind today's session and the annual Digital Health Awards. We were founded in 2017 at UCSF with a mission to help the world's best digital health startups grow, scale, and succeed, ultimately improving care, delivery, access, and outcomes for all. Today, our community includes over 30,000 innovators, from early stage founders to industry leaders, investors, payers, and providers. Throughout the year, we run educational programming, network events, and thought leadership series, all leading to our biggest moment, the Digital Health Awards at Health in Las Vegas, where we celebrate the companies truly transforming healthcare. We're proud to shine a light on this ecosystem and grateful to all of you for being part of it. So congratulations to our 2025 finalists. Your innovation, passion, and impact are helping to shape the future of digital health, and we're proud to recognize your work on this global stage. I am going to introduce Jason Saltzman. He's head of insights at CB Insights. Jason, all yours.
How you doing? Nice to meet you all. I'm Jason. I'm the head of insights at CB Insights. We're a predictive intelligence company focused on helping people understand the companies and technologies building the future. We're excited to partner with the Digital Health Foundation and with Health, the conference, which is in now about a week, as we're scrambling to get excited to see you all there. Right, really, we're partnering with both the foundation and with the event to bring a layer of intelligence to the conference to help everyone understand what's going on in the digital health space. With that, we'll go to the next slide and tee up a little bit about what's happening in the kids' health space. So, I'm going to say the same thing I've said on a bunch of these, which is to ignore the 2021 bar and a large part of the 2022 bar, and really focus on where we're seeing the application and deployment of capital um, in more recent years. Once we're out of the ZERP era where money was free, right, we've seen over $800 million in funding over the last 2 years, and a ton of right. While this funding chart itself may look a little bit depressing in a sense, for people building the space, what we are seeing is that the companies who are getting funding are already sort of among the top performers for company success probability, which is our Mosaic score there. Right, it's a normalized score out of 1,000. Anything over a 600 is in the upper decile of all startups across all markets. When we look at where the funding is going, right, we've seen a massive amount of that fund, that 800 plus million, go into virtual and hybrid pediatric care, and with a bunch of large deals last year. When you look at the average deal size across 8 deals there. Uh, Mental health obviously is another key focus area here, and a space that's seeing a ton of attention and renewed attention following sort of the COVID spike there, and then the post-pandemic spike. We're seeing some key areas, including virtual consultations, mental health, AI assessments. AI is working its way into everything, and the personalization capabilities, especially for mental health and for creating engaging content, workflows, and care paradigms for the pediatric community, is quite incredible to see. When we look at some of the, one of the biggest things, which I didn't realize until right now, is another AI acronym, if you shorten it, is the access to innovation, or the innovation being done around providing access to care. across a broader population, right? We're seeing that 24/7 availability is becoming table stakes. We're seeing hybrid mo models where we're getting both in-person and virtual care. And then we're seeing sort of an increased ability to provide, again, that very personalized care. Uh, I believe that 99.3% match rate comes from Spring Health. When we look at some of the clinical validation and the applications of AI and where we're seeing the most impact, right? A lot of it is in reducing time to care, providing that increased personalization that I've brought up several times now, and then using AI for as a diagnostic tool to create more personalized diagnostics. Right, when we start to look at some of the predictive signals, right, we're seeing that there's sort of an increased number of government contracts highlighted by bright lines, massive contract there. And then we're seeing that there's an increasing shift in B2C or B2C providers shifting more towards B2B, and the distribution channels available there, and some B2B pivots offering more direct to consumer products as well. With that, I'll try to wrap it up and hand it back over to Bethany to tee up our awesome finalists.
All right. Thank you, Jason. It's now my pleasure to introduce someone who's been the driving force behind the Digital Health Hub Foundation since day one, Mark Goldstein. He's the founder and executive producer of the Digital Health Hub Foundation, the awards, the visionary who helped launch this platform. Under Mark's leadership, the awards have grown into one of the most recognized honors in digital health, and none of this would be possible without his dedication, insight, and relentless energy. I also want to introduce someone who brings a unique lens to this conversation, combining deep healthcare expertise with a sharp eye for transformative innovation. Jacqueline Baker, founder and principal consultant at Scarlett. We are honored to have you here with us today. Welcome, Jacqueline.
Thank you. It's a pleasure to be here and a pleasure to hear from each and every one of the startups and the startup founders here today. I'm always inspired by health spaces with a particular love for kids' health spaces because our company Scarlett actually started 15 years ago specifically with the intention to teach etiquette to teens. And so kids have a very special place in our heart, in addition to, of course, as Bethany said, my background in specifically sourcing fintech and health tech companies and coaching a number of startups, hundreds of startups through our collaboration with health over the years. And so I'm excited to hear and to guide the conversation a bit and to hear more about what you're building, what your differentiator is, and how you're going to show up differently, considering that this truly is a competition. Right. And so thank you for being here. Mark, did you want to provide some words as well?
Yeah, look, Jacqueline is going to be our primary moderator for today. We're excited. We have four really great companies. And what's the objective of today? The objective today is to give judges that last piece of insight that they might need to finish up their judging, which ends at midnight tonight. Each of these companies have basically done a great job in putting together their submissions. They wouldn't be finalists otherwise. They've beat out 20 other companies that are gone. So we're dealing with four companies that are the cream of the crop for 2025. They're all winners. What we're really going to see Jacqueline drive here is how are we going to tease out? We want to tease out a little more. We want to basically use this session just to tease out some nuance, something that gives the judge that sort of reason to say, you know what, I'm all in on X company. And that's what we're going to do today. I'm here to support Jacqueline as she goes through the questions. This is one of we've done now 10 of these already this week. And for the next 40 minutes, let's see the stars and see these companies shine.
Fantastic. Well, thank you, Mark. We'll go ahead and dive in so we can maximize our time together. Just as a quick heads up, Sharif, I'll be calling on you first in just a moment. But just remember, as you're providing dialogue around who your company is, just remember that we are looking to challenge and push you to allow those insights around what your differentiators are, what makes you stand out as a company, what really makes you shine. And once again, considering that this is a competition. And so we're very much looking forward to what you have to say. Thank you for the work that you're already doing in the kids' health, the pediatric space, and overall in being a startup leader. And so with that, Sharif, can I throw it over to you to get started and tell us about what you've been building and the impact that you're making?
Absolutely. Bethany, thanks for hosting. Mark and Jacqueline, thanks for judging and helping put this together. And Jason, for the insights. and to my colleagues. Best of luck to all of you. You're doing amazing things. At Cognoa, I think all of us, as we are hyper focused on pediatrics and the future of our country and our world, really does rely on how we invest in our children. And I think, Jacqueline, as you said, it's the most important thing that we can do. And for us, we really want to help children with neurodevelopmental delays. We know that 1 in 4 children will have a risk for delay. 1 in 6 will actually get diagnosed with some developmental delay. And current autism rates are estimated at 1 in 31 children. And the true rate's probably closer to 1 in 26. And there's lots of reasons for that that we can get into later. But ultimately, the true thing that we need to figure out is how do we identify these kids and identify them in a way that gets them the early intervention? So many people don't understand that nearly 40% of children, if you can identify them before the age of 3, will have such remarkable improvements with just traditional therapies that their autistic features don't represent a disorder. The other thing that's kind of exciting that's coming out, and there's a lot of press and news around this, is there are emerging treatments that are coming to the biological basis of autism or other neurodevelopmental delays. And one of the things that we really need to understand is if you can phenotype them or characterize them clinically, then you can start thinking about autism as a spectrum and what treatments are going to be the most effective for that child. And I think what we're going to start seeing is that both early identification and early treatment and more personalized treatment, right? We've been talking about that forever, but the reality is these artificial intelligence tools, which is what we've built, can really help define these children, not only early, but personalize that treatment moving forward.
Excellent. Sharif, thank you for that. I just have 2 quick questions. The first is, while I've dug into everyone's background a little bit, so don't be surprised if you see some random woman named Jacqueline who's on your LinkedIn history of searching you. You all have colorful, wonderful backgrounds. But Sharif, I'm curious, why specifically you and why your team to lead the charge in this particular effort?
Yeah, so unlike maybe some others, I'm not the founder of Cognoa. I was a clinician who was frustrated with the process. I had too many people showing up to my clinic who were 8 and 15 years old, often from underrepresented groups or traditionally marginalized groups, who, the reality is that the system had failed them. And when you look at their chart, you could have diagnosed those kids earlier. These are rural kids. These are kids from low socioeconomic status. These are certain ethnic or racial groups. They were being left behind, and that was extremely frustrating to me. I have a background in both pediatric neurology. I'm a board certified pediatric neurologist, but also board certified in clinical informatics. And despite all my efforts of trying to hire enough pediatric neurologists to do this work, we could not get the waitlist down in Orange County. And so I flew up to Palo Alto. I met the founder and I met the CEO at the time, and they said, we need a chief medical officer. And I was like, I don't know. I'm the division chief. I'm not sure I can do that and this. But I realized, look, if I don't do it, it may not happen. And so I went to work starting in 2017. We got our FDA authorization. And then the beauty of AI is that we can continue to push the limits of accuracy, and we can continue to push and understand patterns that really can help children. And so for me, this is truly a passion project. And it's where I know that as much as I am an excellent clinician and I can help one-on-one children, if I don't do that for the population of children, then I haven't used my skills to that extent, then I haven't met my full potential. And that's what we're trying to do for the kids, give them their full potential.
Excellent. Before I head over to Dr. Larissa at Nest, I just have one other quick question for you, Sharif, if you can answer this one concisely so we can get to everyone. Not that you haven't already been concise, because you have been. It is just the gravity of the fact that what you are working on is big, right? It is a big thing that will make a tremendous impact, which makes me think about the partners that you have in mind or the partners that you have that already exist. And so tell me a little bit about that. Who are some of your key partners, or who are some of the key partners that you know will help exponentialize or 2x, 3x the work that you're doing?
Absolutely. So we've been very pleased to have amazing partners. We have, obviously, my children's hospital is using it, which is Rady Children's Health. We've partnered with Children's National. They're doing a demonstration project where they're trying to help offload the wait list. But probably the most impressive one that I think was the most impactful, and I'll tell you a brief story. We got a call actually from the State Department for a foreign national of ours who was trying to get a diagnosis of their child in Germany. And their experience was taking their child to a German-speaking physician, and the child speaks English. And that physician was trying to give them a diagnosis of something, which wasn't autism. And so we've actually been able to partner with the State Department to offer Canvas DX for foreign nationals who would have otherwise been medevaced and flown and put on a wait list somewhere in the United States to get a diagnosis in maybe a year or two. And so this is really transformative for parents. And so that's been great partnerships with many, many prestigious institutions. I will say that the biggest challenge in this space is really the payers. We've been fortunate to partner with innovative payers like the largest regional Blue in the country, which is Highmark Health, and Medicaid, where we've had partnerships with Wyoming Medicaid, CalOptima, Georgia Medicaid has added us to policy. And so we're starting to see that trend, but we really need the rest of the payers to come to fruition. And so I'm hoping that the Blues and the Uniteds and the Cignas and the Aetnas of the world also put an emphasis on helping the children and doing what's the right thing, but also we do the quintuple aim. So we'll save them money and you can do the right thing. Those are not mutually exclusive things.
Excellent. Sharif, thank you for your time. I appreciate your impact and your responses here. I want to turn the tables over now to Dr. Larissa at Nest. Can you just take a moment and tell us a bit about what you're building and some key things we need to know before we go into questions?
Yeah, absolutely. I'm Larissa Luce. I'm the clinical director of Nest Collaborative. We are a telelactation company that provides accessible care for lactation and infant feeding support across all 50 states in the US. We know that breastfeeding rates are high, but they plummet pretty quickly. And so most babies are not being breastfed for the recommended allotted amount of time, as recommended by the American Academy of Pediatrics and World Health Organization. And so with that plummet increases the risk. We know with babies that are breastfed, they have lower risks of GI illnesses and respiratory illnesses, lower risk of childhood cancers. And most babies are not being breastfed to that recommended 6 months exclusively and on to 2 years of life. So at Nest, we are creating something that's a little bit different than most lactation and infant feeding care, which is typically episodic and problem-based, waiting until there's weight loss problems with the babies and waiting till there's latching problems and babies having infant feeding problems. And so we have created this novel preventive lactation care model that instead follows, in addition to acute care, of course, but it follows sort of a typical timeline like well check visits. You're taking your baby to a pediatrician for a well check visit. Let's do a lactation and infant feeding well check visit that correlates with the evidence of typical breastfeeding cessation timelines and developmental pediatric milestones. And so with that, we're able to kind of tackle challenges before they even begin.
Excellent. Thank you for that overview and thank you for your work in this space. Of course, there are lots of different entities, lots of different practices and verticals under the medical umbrella, if you will, that utilize remote services as a way to treat patients. And what I'm wondering is, particularly considering the intimacy that's involved in lactation, do you all find that a 100% remote model, if that is in fact what you have, is effective? Or what are the challenges that you've experienced as a result of there being a significantly remote model?
Yeah, as I'm also an IBCLC myself, in addition to being a director. So I have worked in different modalities, the in-person as well as the remote and virtual care. And I can say with complete confidence that the virtual model is as effective, if not more effective. And aside from the access, of course, that's giving parents this opportunity to get the support they need in a very broad maternal desert that we have here in the US, it's also quite empowering to be able to provide care to families in a hands-off approach. So instead of being there and helping position the baby and getting the baby to latch in different ways, having this virtual approach and giving them that support where they're doing it themselves. Because when I walk out the door or our clinicians walk out the door, they have to be able to help feed their babies on their own. And so it's really quite an effective approach. Of course, challenges are where there are internet issues and connectivity issues, and we need to continue to advocate for policy change to get broader connectivity across the US in rural areas. But most families have a smartphone. Even if they don't have great internet access, they do have a smartphone, they do have data so that they're able to connect really from wherever they are.
As it relates to, thank you for that. As it relates to the education that clearly your organization is providing and the support overall, are you embracing both a preemptive model and also a real-time model? Meaning, does some of the education and remote services happen in advance of the baby existing on Earth, or does it start? I get it, a baby has to exist in order for them to actually breastfeed, but does any of the education happen pre-baby or pre-birth?
Absolutely. We love for patients to start prenatally, and providing that anticipatory guidance, and clear sort of expectations and realistic expectations of what's going to happen when baby comes. Some patients don't meet us until after baby is here, but we love when patients start prenatally, and that is certainly part of our model.
Great. Thank you. You've been very concise with your responses, which leaves the room for a third question, which is the future, right? It is always, I understand as a startup founder in the spaces that you're all in, it's constantly great what I did over the last 3 months, but what's next, what's next, what's next? And so let me join that bandwagon. If we fast forward a year from now and we're having this conversation, what do you feel pretty strong and confident that your organization would have accomplished based on where you're at now and the momentum that you have?
Yeah, we really are advocating for policy change. And to piggyback on what Sharif was saying, of course, payers is always one of the biggest issues. And for lactation codes in particular, it is not part of the standard CMS Medicare physician fee schedule because we don't see a whole lot of Medicare patients. Our clientele tend to be a bit younger. And so when payers are often relying on this fee schedule for their coding and there is none for lactation, is sometimes not recognized, and particularly preventive care codes. And so we are going to continue that fight and advocating for policy change to make lactation a more recognized and standardized process for coding. And then also looking at it as the big picture, a really sort of whole body holistic approach. It's more than just the physical. It is really the whole family approach, the support, really taking into social determinants of health to provide them the support they need to meet whatever infant feeding goals they have.
Fantastic. Thank you. I appreciate your insight and your work in this space. Before I head over to Marcia at Imagine Pediatrics, let me just give everyone a preemptive heads up. After we finish our briefings here, I am going to make another round and I'm going to be asking one specific question, and I wanted everyone to have a heads up on it. And that is, who doesn't want you to win? Right? I don't necessarily love the who are your competitors, but what entity, organization, institution who doesn't want you to win? And it allows you to think differently about things overall. But we're going to do another circle round here and answer that question. And I want it to be fair and give everyone the same amount of time to think about it. Okay. So with that, Dr. Marcia, I would love to hear what you all are working on and committed to at Imagine Pediatrics.
Well, first, let me thank you all and echo our gratitude and appreciation for being part of this group and for all this group's work on pediatrics and adolescents, because it's such a needed space in the industry. I'm Marcia McPherson. I am not a physician. I apologize. I am the Chief Commercial Officer here at Imagine Pediatrics. And we were purposely founded in 2022 by an emergency medical pediatrician and several other co-founders, one of whom had a child with medulloblastoma that he walked the walk of a caregiver with special needs. And 3 weeks after, unfortunately, losing his son, he gathered together with a couple other folks and founded Imagine Pediatrics to be purposely focused on helping caregivers and children with special healthcare needs. We'll serve from 0 to 20 years of age. We work across 41 different medical and behavioral condition categories. It's an integrated medical, behavioral, and social care model. We are a pediatric medical group with very specialized programming for this population. We work different kinds of conditions in the medical space across genetic conditions, asthma, diabetes, gastro, neuro, developmental, the whole gamut of complex medical conditions, as well as what you can think of as the top of the SPMI stack. So we have about 20% of our population also that's in autism, that has autism as a comorbidity, bipolar, schizophrenia, suicidal and homicidal ideation. Those are the children that we serve. And we're serving about 40,000 of those children today across the nation. We're very grateful to be doing that in partnership with some very large health plans. And we do that through
up and downside total cost of care risk arrangements. We're entirely dedicated to having aligned incentives and outcomes with our plan partners. We started off very, very focused on Medicaid and wanting to make sure we were serving the underserved. And so all 40,000 of our patients today are in Medicaid. We have line of sight to having about 100,000 patients by the end of the year. And our plan partners have asked us to move also into the commercial line of business. So we're now serving those patients as well, and will be later this year. We do all of this work very much to expand access to pediatric medical and behavioral care. And so we do not kind of come in and move a child away from their PCP that's designated or away from the specialist that they've been working with. Rather, we wrap around, augment, and extend that care in a very collaborative way by delivering 24/7 virtual and in-home services. So lots of pediatricians' offices don't have an embedded behavioral health capability. They don't have social workers, dietitians, and pharmacists that are on call and available to them, nor can they get into the home to do infusions, injectables, blood draws, et cetera. Instead, they have to ask that child who might have, special technology needs like G-tube, trach vent, et cetera, to go to a lab or to come into the office. And so we can extend their reach and keep that child safe at home and make sure that they get 24/7 care and avoid exacerbations that typically would put them into the ER or the inpatient setting. So we've been doing all of that work now for 3.5 years, and are really excited about the outcomes that we're seeing in the population. We have an 86 plus net promoter score, which is one of our most important statistics. And we've just done our first few risk settlements with our plan partners that are delivering in a 20% medical cost reduction range. And so we're just getting started here and have been doing it at scale in a very personalized, tech-enabled way. We were built from scratch like that, and are really excited about what we can continue to bring to these families who just really desperately need as much support and care as they can get access to.
Excellent. Thank you for you and your team's commitment to this space and Imagine Pediatrics. One thing for sure that I have learned throughout my career is that it is okay to say when you made a mistake. And I want to extend that over to founders as well, because founders, sometimes we feel like we have to always have the right answers. But with that, I realized that I mispronounced your name, and it's Marcia.
Oh, fine. Yeah, no problem at all. You won't be the first, Jacqueline. You won't be the last. It's Brady Bunch spelling, if that helps you remember it.
But no worries. It's our job to say, I didn't get that right, and I apologize, and I'll do better next time, Marcia.
Thanks.
I do want to ask you about conditions. It sounds like through the commitment of your work at Imagine Pediatrics, there are lots of conditions that you cover, which is fantastic. Are there conditions that you know that your team is not equipped to cover?
Yes, so there are some conditions that we often will not select our patient population for, but that we will end up having as a comorbidity in our patient population, and we will work very hard to connect with the local community-based resources who can serve that. So for example, substance use disorder. That is not something that we particularly select patients that have. We often find that as an underlying comorbidity, and sometimes we surface that as an unknown until they're starting to work with our team. In that case, we will work very hard to get them to an organization that will manage those substance use disorder activities as acutely as they may need to be managed. So that's one example of a population that we're not selecting for it. We're not built to manage substance use, but we very much kind of find that in our population and partner with organizations to make sure that the kids get what they need. And then there are just a lot of children who are healthy or may have asthma, but it's a well-conditioned asthma. It's not an acute exacerbation. It's under control. And then that is fantastic for that patient to continue to work with their PCP and get all the services that they need. They may not need the level of intensity or the types of services that we need. So there are less acute conditions or single conditions within a population of pediatrics that we would not necessarily lean into support. We do really look for patients who have medical and behavioral comorbidities and some kind of level of acuity where you need this level of kind of integrated, always available, and ability to get into the home type of service.
Excellent. My second question is about expansion, because it does feel like pieces of your business, or when I digest it from what you said, is pieces of your business are very personal, high touch, if you will. And
Yes.
so it makes me think about expansion overall and your ability to staff up with resources that can serve your organization as you continue to expand. So tell me a little bit about your expansion strategy, particularly the professionals that are going in home to treat these children.
Sure. Yeah. I mean, we do have our medical group now set up from an expansion perspective in 15 different states, often led by where our plan partners are asking us to go next. And when we come into those states, we do hire local market as well as national remote uh, clinical team members to fill out our multidisciplinary teams. Every child is empaneled with a multidisciplinary team that is led by a pediatrician, includes BH therapists, dietitians, pharmacists, social workers, community health navigators, et cetera. And some of those people will be in the local market, those folks that are boots on the ground that do the in-home work. But many of those people can work remotely in our 24/7 virtual model, which allows us to really expand pediatric access to local markets, especially very rural populations where it's very hard to find pediatric care. So we're using both of those modalities to hire our staff and to expand very rapidly. But the people who are on the ground and are in the homes are either pediatric trained paramedics that are employed by us, and they'll go into the home and do their work with a pediatrician in a telemedicine oversight visit. Sometimes we will use a nurse, depending on the local market requirements about the type of person that you can send into the home and the types of things that we're doing. And so we are able to expand very quickly into a market by having both the virtual remote as well as the in-market services. Did I answer your question, Jacqueline?
You did. Absolutely. Thank you for that. I do want to, before I head over to hear all the amazing things that Y Therapy is doing, Marcia, I would like to know why. Why do you choose to commit your time and energy and your talents and treasures to this space?
Yeah, I think for me personally, I'm not a clinician, and I did not have a background in kind of being in the provider space. But as I, evolved and looked at the next chapter of my career, and I met the Imagine Pediatrics incredible leadership team. Our Chief Medical Officer, Dr. Trish Hayes, is Meds Peds board certified. Our Chief Behavioral Health Officer, Dr. Courtney Bolton, is a psychologist by training, and they had just built an incredible clinical model. And it felt like something that was very mission driven. It felt like it was something that was right for the time and the need of the population and value-based care focus in healthcare. And I wanted to be part of that team, and I wanted to be part of serving these families. And so I signed on a little over 2 years ago to be part of this incredible team and have no regrets.
So thank you for sharing. We appreciate that. And I look forward to hearing from you in just a few when we circle back with our additional question. Renat, can we hear a bit about what you all have built over at Y Therapy, the impact that you're making, and maybe even some key differentiators?
Sure. So I want to first of all thank everybody for this opportunity, and thank you everybody for this space. The children's space is close to my heart, always have been. So thank you very much for the wonderful work and this opportunity to hear everyone. So what we created at Y Therapy is a digital intervention where every child, no matter what his learning abilities are across this age groups of between as young as 2-year-old to, I think our eldest today is 36 on the platform, can see themselves overcome challenges they are facing in real life and learning life skills in a way understandable to them. And by practicing and rehearsing in a digital way fitted to their abilities, they are able to apply what they've learned in the real surroundings. So this work was actually from my personal experience. I am a BCBA in my profession. I specialize on young children with the autism spectrum, have been working with them all of my life. And I think that the one thing that always hurt me as a clinician in that space is that I saw too many kids who were not achieving their independence goals as they were growing up. And the impact of a child not achieving independence as they grow up is a huge impact, not only on his family, but also in the community and as a society as a whole. So what we looked for in the care model is we said, let's look at the care model and how the care is provided today to this child. And let's find a way that we can give a digital tool to the child, no matter what his learning ability. And we have 2-year-olds holding tablets and learning life skills on their own. And that's really the impact that we're doing. And when we're talking about life skills, we're talking about the essentials. We're talking about feeding, about toilet training. We're talking about the ability to go to one place to another. And really all those fundamentals that children have to gain in order to be independent as they grow up.
Fantastic. Well, thank you for sharing a bit about what you're doing at Y Therapy. My question first is, and you started to answer it towards the end of your briefing there about what particular life skills, like what those are. I heard the feeding, I heard independence. Can you share with me just a couple of other key life skills that you're targeting initially, and maybe even some of those advanced ones that maybe a little bit more in the future?
Of course. So right now, what we started building in the first place is a skill builder. That means what are the skills they need to build in order to be independent. So we're working in two main areas. First, the daily living skills. Those are initiatives. Those are the ability to transition from one place to another, to join an activity, like I said, feeding and toilet training. Also, the ability to be around other people or children with the autism spectrum, that's sometimes around other children that might be a great difficulty. The ability to join an activity, to sit down at circle time, or to sit down in your classroom, or to go outside on vacation with your families. Looking at the more medical point of view, one of the things that these children have to go through a lot of times is medical procedures in medical settings, in hospital settings, or other therapeutic settings. And what we did is with hospitals, and we're working now with Children's National, for instance, here in Washington, D.C., with compliance with medical procedures. That means that those children can see themselves enter a medical procedure, a complex medical procedure sometimes, like MRI, EEGs, and things like that are very difficult for children, certainly children with neurodevelopmental disabilities, to go through. By seeing themselves in the way they understand that they are able to complete that medical procedure, then they are able actually to go inside and do it. So those are really the two key areas that we're focusing on, which is the independence and the health of the children. And for order for those to get along and to be predictive for the child himself, those are the ones that we're focusing on as they grow up, so they will be able to take better care of themselves.
Thank you for that. I am curious about experience. And when I say experience, I mean the experience that the child will go through or the participant will go through as a result of going through wide therapy overall. When I was listening to you, particularly talking about your focus in ensuring that even medical procedures, that they are primed and ready for those, there's an experience or a process that happens. And so tell me about the experience that a participant would go through in engaging with wide therapy and what that looks like, and what's your vision of what that looks like?
Well, I think it's already about what we're implementing. So it starts really with a caregiver or a therapist or a parent that wants to teach a certain skill to a child. So what they need to go through is to take pictures of the child himself and the real environment, if it's a medical setting, in a way that wide, and that's really our specialty, guides that parent or that therapist on which pictures to take. They can do it on any phone. They don't need any special equipment. They can even take it offline if it's a remote place that they need to go to. And then the wide therapy platform constructs a digital practice based on those pictures. Then that's on the therapist side or the provider side. And then they have the child himself. So once it's constructed, like I said, children 2-year-olds, or oldest is 36 with neurodevelopmental disabilities, they open up a tablet and the first thing they see is first engaging rewards for themselves that they're picked for them. So they'll be engaged with the platform. It's also part of the method itself. And then the next thing they see is themselves. They see still pictures of themselves going to that specific space or going and doing that specific activity, but in a way that's not video based, but still picture based. Because imagine okay, this is a competition. So if we want a snapshot what the ending would look like. The athletes do it all the time. They see themselves on the podium at the end point of the behavior. So if we take a medical procedure, they see themselves at the end point of it. They see themselves already inside the MRI machine. They see themselves already putting on the equipment that they need to, and they get reward for it digitally. Once that happens and a child can practice this over and over again in a digital way, first of all, they become very happy. I wish I could share videos of children. They smile, they just clap when they see it, even the nonverbal ones. That's also it's for them because it's only picture-based and not language-based. And once they see that success, we have children, once they get into the real life and the medical procedure, telling us, I've already been here and gone sit down on the chair itself or the dentist chair and go through the procedure calmly. So that's really the process they go through.
Thank you for sharing that. And to put your words with what my visual is projecting, it sounds like a bit of projection, right? It's almost superimposing themselves in equipment with paraphernalia on, equipment on, to see digitally what I would look like in that space.
Exactly. And then it's rewarded. So that's really the important element. That's actually what we got a patent on how the child can learn this skill in this specific way. So once it's rewarded in a digital way, it's like they've already done it in real life, and that's what enables them to actually do it.
Excellent. Thank you for that. So let me take a second and thank all of you for the work that you're doing, for taking the time to answer questions and to engage, and to also be so complimentary of each other and camaraderie in terms of the kids' health and pediatric space. Now let's take a second and do a quick round. I would love to hear your answer to the question that I posed a short while ago of who doesn't want you to win. And I'm going to be a bit time restrictive on this one just to make sure that if there are any other questions that need to be asked of the rest of the team, we have a little bit of space for that. And so I'll give you a maximum of 90 seconds to answer this question. I am a stickler for time, and so let's be as concise as possible here, but I would love to hear who you believe would not want you to win in your space. And let's switch it up a little bit. Dr. Larissa from Nest Collaborative, I'd love to hear from you first.
Formula companies. They are the ones that do not want us to succeed. At Nest, we participate in some IRB approved research to really make sure that we can quantify our outcomes and make sure that they are evidence-based and peer-reviewed and unbiased. And we have seen through this research that our patients are breastfeeding at more than twice the rate of the national average, as reported by the CDC's breastfeeding report card, at 12 months. And so formula companies don't want that because they're not making money when babies are being fed at the breast instead.
Got it. And so, of course, I encourage you to figure out a way to bake that into your conversation because it makes that question null and void for whomever you're speaking with. So thank you for that. Marcia, can I hear from you from Imagine around who you believe would not want you to win?
Sure. Yeah, we think about that a lot. And I think what I would note is our experience now operating the market is that the pediatric space in general is incredibly collaborative, and people seek to lean in and make sure kids have what they need. So just like on this call, we have found that in the market. But the prototype of an organization that might not want someone like us to win would be an entity that is very oriented to fee-for-service maximization, that their revenue model is propped up by making sure that there are more patients walking through the door and they have more time in an acute setting, including more days stayed. And there are a few organizations like that across the ecosystem, but by and large, the children's hospitals we work with, the health systems, the complex care clinics, the private duty nursing agencies, all of them are very oriented around the right thing for the child at the right time. But we do occasionally run into an organization that, when we do our work and make sure there's preventative care and we have more safe days at home for our children when they don't have to go to the ER or the urgent care, they don't have to be admitted to a hospital, or we can get them discharged faster into our care and then back into community care. There are some organizations who say that's money out of my pocket and I don't like you doing that. So those are the kinds of organizations that, because we're so committed to value-based care and we win when we reduce those costs, they then tend to see that as competitive.
Excellent. Thank you, Marcia, for thinking through that so quickly and concisely. Renat, can I hear from you on who would not like you at White Therapy to win?
Well, I think that I don't know if they will like it, but they're maybe scared that because when we found a system that can deliver therapy to children directly without the need, for instance, for a therapist, then some therapists might feel that this is threatening to them in a sense that I think that's the era of AI that everybody feels that it might take over their job or take over what they need to do. And I think that we all should take an approach that says there are things with therapy, certainly in our space with children, that a computer, no matter what AI, will never be able to change. And that is the human connection. And I think certainly with children, we all need to understand that when we have a 2-year-old with autism, even though we found a way to give him life skills, we can never replace anybody who's giving him therapy and connection-based therapy in that sense. So I think that that's the one thing that I encounter the most, maybe a sort of a scared feeling, is this going to replace me and my work? And I really think that if we understand that in this space, the children need us first and technology second, that would be really the thing to understand how it can amplify our work.
Excellent. Thank you so much for sharing that, Renat. Sharif, can you round us out and share with us who would not like you, and not particularly you, Sharif, but your organization to win?
Yeah, I was gonna say, only people that hate children don't want any of us to win, right? So if you hate kids, you don't want us to win. No, kidding aside, I think There's two maybe groups that don't want us to win. I think one is actually fraudsters. So unfortunately, in the autism space, there has been a significant amount of fraud, and you know that's something that's being investigated. And one of the things that Cognoa's Canvas DX does is it provides an objective third party with no stakes in the game assessment for these kids, regardless of the developmental delay that's being presented. And so if you have that, it makes it much harder to do fraud and say, oh, this child needs X, Y, and Z therapy. So it's getting the right children to the right person at the right time. I think the other one that's actually very disconcerting is we've had conversations with some of the payers, and frankly, they'll tell us they don't want to pay for therapy because it's expensive. And reality wise is you would never do that for someone who had a brain tumor or a cancer or a life-threatening disease. And so for some reason, something happened in the neurodevelopmental space where payers feel like we don't need to pay for this, it's expensive. And so I think that that's in some ways a very strange thing because even the cost economics do work out, but I think it's a lack of understanding in the space.
Okay, thank you for that. And thank you all for so quickly coming up with that answer. And additionally, in being transparent and honest about that answer. And here's why I say that. Like there are lots of entities I speak with who will quickly say everybody wants us to win. And it's just not true. And we want it to be true that everybody supports kids things everywhere, but there's a business layer here that we have to be honest about. And we're growing something that we will monetize. And there are other people that want to monetize something as well, right? And so I think we just have to be honest in this space. We have about 6 minutes left before I turn it back over to the Digital Health Hub Foundation team to close us out and talk about next steps. And there's an opportunity that I want to open up here as it relates to a wish list, right? If you think for a second, my one wish list item that I would love to have that I know would expand our company, stabilize our company, grow our company is this. And what I would love to, how I would love to hear from that from you is in the form of one word. Like, what is one word? I know that that is quite a challenge that is on your wish list that if you could say in a year, this wish has come true as a result of the work that we've done at our organization, I would love to know what that word is. And because I'm giving you such a quick amount of time to turn this around, I'll up it to 5 words, but one is my desire here. Okay. All right. And I'll take anyone who'd like to volunteer for this one. Is anyone ready with your wish list of 5 words or less?
I don't know if it's a wish list, but I'll go first. I think it's hope.
Whoa, Sharif, you already gave me too many words.
Hope. That's
Okay.
the word.
Okay.
I think that's what we're trying to do is give hope to families. And I think if we can do that, I know that that's giving success because when you understand early, you can give hope.
Okay, excellent. Thank you. Marcia, I saw you inching ahead to go. Is that accurate?
Well, I can't, but I'm very impressed by Sharif's answer of hope. But I would say from a business model perspective, continuation of telemedicine flexibilities in CMS by CMS.
I'll take it because it's creative. I'll take it. Right.
Because there's so much you can do digitally, and we need the landscape of the regulatory environment to support our ability to reach out and meet these patients where they need it, when they need it, in their home, day or night. And we rely on those telemedicine capabilities to do that.
I think all of us can support that. Marcia for the win on that one.
Absolutely. Dr. Larissa, do I see you nudging forward to go?
Yes. In one word, reimbursement. And within 5 words, and recognition of standardization of lactation as a code.
Okay, excellent. And Renat, can I hear from you to round us out, please?
Yeah, I think for me, the word is ability, because I think that's what we're all about the gift of ability. And I think that if we expand that gift forward and give it to more and more people, then everybody will have more abilities to spread forward. So that was a lot of words, but cutting it down is the gift of ability.
Excellent. Well, listen, thank you. We've come to the end of my time with moderating our conversation and honestly being enamored and impressed with what you've built and feeling proud about the future for kids that exist now and the kids that will exist in the future, because there are fine, professional, talented, and heartfelt people and leaders just like you that are changing the world through your innovation. And so I thank you. I certainly look forward to meeting you in the future if that ever becomes possible. And with that, I'm going to turn it back over to the Digital Health Hub team to talk about next steps and to close us out. But thank you for allowing me to be here with you today.
Thank you,
Excellent.
Jessica.
Thank you so much.
Well, you guys were really lucky. Jacqueline, you have been without a doubt our best moderator champion of all.
Thank you.
And huge claps. Huge, huge. You're amazing. You're amazing. I want to package you. You're great. So look, this was a perfect session. I think you guys, she teased that out. She teased out your differentiation. She basically created reason for the judges to very clearly make their decisions. So all I can say, I'm going to hand this over to Bethany to close this out. We'll see you in a week or so. And once again, Jacqueline, you are good. You are so good. Thank you. You're our new role model. It's great. And congrats, guys.
Yeah,
All
this
right.
was great. Thank you to both of you, and thank you to all of the finalists here. I just want you to remember to mark your calendar for Monday, October 20th, where we crown the winners live across 4 stages at Health in Las Vegas. There is a website for this. It is on the 2025 dropdown. There's a grand finale agenda, and there's an add to calendar for each stage, which will make it easy for you to pop that in your calendar. Don't forget to join us afterwards at Chica in the Venetian from 6 to 9, where DJ Klasko will be spinning Taylor Swift songs, he told me, and we'll toast to the winners and celebrate with the entire digital health community, and hopefully all of you. So it was great to meet you and hear from you. Thank you, Jacqueline. Thank you, Mark. And everybody have a great day.